Hey students, it's Dr. Kessler and you are listening to the lecture for Chapter 13, Fluid and Electrolytes, Balance and Disturbance. It's quite a long chapter with a lot of information, so take breaks as you need to. This will probably be the longest lecture that you have from me. I couldn't really figure out a good way to break it up though. So your objectives, you should be able to differentiate between osmosis, diffusion, filtration, and active transport. You should be able to describe the roles of the kidneys, lungs, and endocrine glands in relating to the body's fluid composition and volume. Plan effective care of patients with fluid volume deficit, fluid volume excess, sodium deficit and excess, as well as potassium deficit and excess. Describe the causes, clinical manifestations, management, and nursing interventions for all the electrolyte imbalances. Explain the role of the kidneys, lungs, and chemical buffers have in maintaining acid-base balance, and compare metabolic acidosis with alkalosis as well as respiratory acidosis with respiratory alkalosis, as well as knowing the causes, clinical manifestations, diagnosis, and management. Maintaining homeostasis is vital to our survival, and that should have been apparent whenever we had, I think it was chapter 6, talking about stress and adaptation. But the kidneys play a vital part in regulation of fluid and electrolyte balance. They regulate the extracellular fluid volume and electrolyte levels by retention and excretion of bodily fluids and electrolytes. Regulates the pH of the extracellular fluid by retention of hydrogen ions and excretes metabolic wastes. The heart and blood vessels play a part. The heart pumps, which circulates the blood through the kidneys, which allows urine formation and allows that glomerular filtration to occur. The lungs play a major role in acid-base balance, and we will talk about that whenever we get to that part. The pituitary gland stores and releases ADH, or antidiuretic hormone. The adrenal gland secretes aldosterone, which affects the amount of sodium and potassium that is either retained or lost. The parathyroid gland will regulate calcium and phosphate balance through the parathyroid hormone. Baroreceptors are located in the left atrium and the carotid and aortic arches. They regulate sympathetic and parasympathetic neural activity, as well as endocrine activity. So they will respond to changes in blood volume and will either stimulate or inhibit the sympathetic and parasympathetic nervous system. The renin-angiotensin-aldosterone system. Renin is an enzyme that's released by the kidneys, and it's released in response to decreased renal perfusion. The renin will convert to angiotensinogen, which will then convert into angiotensin 1. Then the angiotensin converting enzyme will convert angiotensin 1 to angiotensin 2. Angiotensin 2 will then constrict the vessels and increase the arterial perfusion pressure, and this will stimulate thirst. So you're going to want to try and drink and take more in orally. As more renin is released, the body responds by releasing aldosterone. The antidiuretic hormone works with aldosterone and the baroreceptors to excrete water. It plays a major role in determining if urine is diluted or if it is concentrated. Osmoreceptors sense changes in sodium concentration. When osmotic pressure increases, neurons become dehydrated, releasing impulses to the pituitary gland, which will increase the ADH, or antidiuretic hormone. Natriuretic peptides affect fluid volume and cardiovascular function through excretion of sodium, direct vasodilation of the vessels, and opposition of the renin-angiotensin-aldosterone system. So those are the main areas in the body that will help you to maintain homeostasis. Treated, and they'll go down that rabbit trail and not even think about the chloride. All right, you guys are hanging in there. We're almost done. So now we're going to talk about how your body maintains acid-base balance. The plasma pH is an indicator of hydrogen ion concentration, and it measures the acidity or alkalinity of the blood. It is a buffer system. There's a buffer system that prevents any major changes in the pH, and it does this by either removing or releasing hydrogen ions, depending on if they're in acidosis or alkalosis. So if they're going one way or the other, it'll either remove some hydrogen ions or it will try to release more into the blood. Extracellular fluid buffer system is bicarbonate carbonic acid buffer system. The kidneys will regulate the bicarbonate in the extracellular fluid by either absorbing or regenerating it. The lungs control the CO2 carbon dioxide, which when combined with H2O turns into carbonic acid. So your kidneys and your lungs are your main regulators for acid-base balance. Metabolic acidosis, your body will attempt to compensate by Kussmaul breathing, which is labored deep breathing, as well as the kidneys excreting hydrogen ions and conserving bicarbonate ions. And this is to help restore balance. So your two systems, your lungs and your kidneys, Kussmaul's respirations for labored deep breathing, which affects your CO2 and your carbonic acid. And then your kidneys are going to excrete hydrogen ions and they will conserve or hold on to bicarbonate ions to try and restore balance. Peripheral vasodilation and decreased cardiac output occur when the pH drops to less than 7. And so they will have symptoms of decreased blood pressure. They will have cold and clammy skin, dysrhythmias, and they can go into shock. What you want to do, find out what is causing the metabolic acidosis and correct it. If it is extreme, you can give bicarbonate, but you do not give bicarbonate during a cardiac arrest. Okay. Make sure you watch their calcium levels because that can be low if you have someone who has chronic metabolic acidosis. And you would want to treat the calcium before you treat the acidosis. Metabolic alkalosis. The body's attempt at fixing this problem is depressing the respirations. So here your pH and your bicarb are high. So your body is going to try and compensate with how much CO2 does or does not come into the body. Okay. Metabolic alkalosis, you won't see a whole lot. Acidosis, you might see more than the alkalosis because that just, if you have excessive vomiting, long-term gastric suctioning, then you can have metabolic alkalosis. If you have long-term diuretic use, you can see it as well. Hypokalemia, low potassium, can produce alkalosis, and that's just because your body is attempting to compensate. Okay. Respiratory acidosis can be acute or it can be chronic. If it's acute, the causes would be pulmonary edema, aspiration, atelectasis, pneumothorax, overdose of sedative medications, administration of oxygen to a patient who has chronic lung disease, and that will in turn give them too much CO2 in the blood. Treatment is improving ventilation. So you can give them bronchodilators. If there's an infection, you'll give them antibiotics. If they have a pneumothorax, you can put in a chest tube. If giving less invasive treatments does not help, then you can put them on mechanical ventilation, and that will definitely help. Okay. Respiratory acidosis is due to the fact that they cannot get rid of the CO2. So it is going to be caused by some sort of respiratory condition. If it's chronic, then your body learns to compensate. So your patients with COPD will learn to compensate with extra CO2 in the body. So you have to look at whether it's chronic or it's acute, because those with chronic lung conditions can have chronic respiratory acidosis. They won't present with as severe symptoms. They might just start to be really tired and fatigued and not be able to move around as much and become short of breath quicker. So you really have to watch them. And then they can have changes in their level of consciousness as well. But it tends to be more subtle. Respiratory alkalosis, your patients who hyperventilate. They get anxious, they start to breathe faster, more shallow, and then they hyperventilate. They get lightheaded, they can't concentrate or focus on anything, and then they start to freak out because their fingers start to tingle and go numb, and their toes will tingle and go numb. And if it is not dealt with, breathing into a plastic bag or a paper bag, and you can't get their breathing slowed down, then they'll pass out. So treat it by correcting the cause. Okay. Arterial blood gases, this is how you are going to check for any acid-base imbalance. Whether you have acidosis or alkalosis, this is how you're going to check. So your pH is generally going to be 7.35 to 7.45. Your CO2 is, or arterial CO2 is going to be 35 to 45. And then your HCO3 is 22 to 26. Very, very important. PaCO2, if you're looking at a continuum, you want to flip those numbers. So pH, anything less than 7.35 is acidic. Bicarb, anything less than 22 is acidic. For your carbon dioxide, anything greater than 45 is acidic. So it's flipped. Okay. You can also look at the O2. That should be 80 to 100. You can also check your pulse ox, which is your peripheral check, and that should be greater than 94%. And this is how I like to interpret ABG. So let me see if I can get my pen to work. Let's see if you have a pH of, we'll say 7.27. Just want a stylus would be really nice. And then we'll give, wow, okay, that's a C. I know it doesn't look like it's C. O2. Say 50. And then H. Wow. C. O. 3. Of 26. Okay, that looks absolutely horrible. And I will have a class whenever we do our live session on interpreting ABGs, okay? But ABA, A is acid, B is base. And then in the middle, what is it? So if your pH is 7.27, it is on this end. It's acidic because it's lower. So we're going to circle acid. Your CO2 is 50, which is over on this side, which is an acid. And your HCO3 is 26, which actually is right there. I made it really easy for you. So you're going to look at, first of all, what is aligned with your pH? Is it your CO2 or is it your HCO3? So your pH is A for acidic and your CO2 is A for acidic. So you know it is, wow, respiratory. Oh, that's horrible. And is it acidosis or is it alkalosis? A is acidosis, B is basic or alkalosis, so you know it's acidosis. Dosis. And then you need to know if it's compensating, not compensating, or partially compensated. Because the bicarb is in the same, is not moving yet, the body hasn't attempted to compensate, so it's not compensated. If the body had started to compensate in order to make the pH less acidic, it's going to move this way, and it's going to try and hold on to more bicarb, which will then hopefully pull that pH back over. Because you don't see it over in this area, your body hasn't started to compensate yet. If your body has fully compensated, your pH will actually be here in the normal, but your other two will be abnormal. And we will have a live session about that. You can also go into YouTube and look at ABG tic-tac-toe, and that's a different version, but that is another way to kind of figure it out. I believe that is